Today's Spotlight is brought to you in part by presenting sponsor, First Community Financial Bank, the community bank where you come first. If you're just tuning in, you're watching Spotlight. I'm your host, Jane Wynette, and joining me now are Dr. Weiner and Danielle DeGrado of Linden Oaks Behavioral Health. So welcome. We're excited to talk. Well, I guess excited might be the wrong word. We want to talk, though, because it's important, about the opioid addiction. And we want to talk about how that is impacting us and the work that you're doing at Linden Oaks. So let's start, Dr. Weiner, with you as far as how do we get here? What is it going on?
Yeah, so right now we are in the midst of an opioid overdose epidemic. There's more people dying from this every day than we've seen in a very long time. Right now that number's at 91. In the state of Illinois, to put this in perspective, more people are dying from opioid overdoses than motor vehicle accidents. And twice as many people actually are dying from opioid overdoses as motor vehicle accidents, and 1.5 times as many people from opioid overdoses as all violent gun crime. So it's truly an incredible problem, the scope of which we haven't seen in a very long time. It started probably back in the late 90s when Oxycodone came out. The pharmaceutical company Purdue that made it was marketing it very hard, was saying only 1% of people are going to get addicted to this. That they were saying to physicians, you don't have to worry about it. They actually had 20,000 trainings that they did to promote this, and the result was we were told we were under-medicating pain. We were told that pain is the fifth vital sign, and now America actually consumes 80% of the world's opioids, and we have 5% of the world's population. So it's really just gone up.
That is a staggering statistic, and extremely concerning.
Mm-hmm.
Yeah,
for sure. Yeah, it's gotten very much out of control. The president actually recently declared a national state of emergency over this to free up some funds. We've seen legislation come through both on a federal level and on a state level to assist with this in various ways. It's something we're all taking very seriously. We all need to do our part.
And when you talk about how we got there, as far as, you know, the companies were sort of pushing that we need to take care of the pain, and so it's people just getting hooked on that opiate and then not being able to get themselves off of it when they're done with their medical treatment. Is that what's happening?
Yeah, so that's one part of it. Actually, 80% of people who use heroin, which is something else that we're hearing a lot about, heroin and fentanyl on the streets, 80% of people start with prescription pills, and most of those people are getting them legally from pharmacies.
Okay. Danielle, what do people need to know if they were prescribed an opioid when they went through a medical, treatment or something along that line? What do they need to know about doing after that?
Mm-hmm. So first of all, we want to say it's okay to take the medication. We're not here to discourage people from taking it if needed, but we do have a few recommendations. The first one being having a discussion with your provider before taking it about what the treatment plan is, how long you're going to be on the medication, when should you get off of it, and what should be your expected pain relief. Kind of developing a comprehensive treatment plan to address the pain. The second thing is to really feel comfortable and open and honest about talking with your provider if you're struggling to come off the medication, if you feel like you're taking more than you should be, or if you are struggling with any sort of addiction. We want to encourage people to be reaching out to their providers to have those difficult discussions. And the last thing is safe disposal of the medication. So there's a statistic that only about 28% of the medication is actually used. So there's a ton of this medication left over, and people are storing it in their medicine cabinets, giving it to their friends and family. And really, we should be returning these medications back to the pharmacy for appropriate disposal.
I think that's an important point, and I know that here in Naperville, the fire departments have put boxes where you can safely dispose of that, because I think that is very true. Oftentimes, it's kind of the bad thing. You think, oh, well, I feel better, so now I don't need to take it. But then, as you say, it just sits in the drawer, and who knows how that might get used.
Yep, absolutely.
Give us a little bit of an understanding. So we've reached out. We have a little bit. We realize possibly there's some concerns here with some addiction. What do we need to do next? What happens? You're doing some medical assisted therapy. How does that work?
So medication-assisted therapy is the use of medication in combination with counseling and behavioral therapy to really provide a whole patient's treatment approach to addressing substance use disorders. So substance use disorders really are a combination of biological, psychological, and social components, and the medication really addresses that biologic component. So it decreases the cravings, decreases withdrawal symptoms, so patients are really more engaged in getting more out of the whole treatment process.
Okay. And Dr. Weiner, I mean, I know some people sort of might say, well, now you're replacing one medication with another medication. What do you say to that?
Yeah, so that's one viewpoint, that we're just replacing one with another, but it's a means to an end. So when you're on these medications, the most common ones and the ones that we're prescribing are Suboxone is the main one. Another one you'll hear a lot about is methadone. The last one is Vivitrol, but for Suboxone and methadone in particular, they're long acting, and you're not going to get high off of these medications. The last one, Vivitrol, you won't either. So really, it's the difference between what you were doing before, which is probably buying pills off the street or using heroin, a very roller coaster experience of a life, to you go to Walgreens and you pick up your prescription. You take one a day, or sometimes people take it morning and night, and you live your life. You go to treatment. You're able to engage back with the world again without it constantly revolving around withdrawal, when you're going to get your fix, how you're going to buy it, what about the police. All that goes away, and you can just focus on getting healthy. Okay.
Now, Danielle, what's been the research effectiveness? I mean, what have you seen with patients that have taken this treatment plan? How is that working?
So the research has been all positive. There's been a lot of research studies showing how effective medication-assisted therapy is compared to, no medication, and just kind of toughing through it is what we call it. So these medication really help patients, like I said, engage in treatment. It decreases opioid use, it decreases relapse risk, it decreases overdoses, and we're seeing it increases treatment retention. People are staying in treatment longer and really able to get their lives back. And especially Suboxone, it's a lot less intrusive, like you said, than methadone. You don't have to go to a clinic every day. You can go to an outpatient provider, and it's just a better, it's a better option for some people.
Okay. Now, you started, Dr. Weiner, you've got the MAT clinic at Linden Oaks, and very, leading on this charge. What could somebody expect if they were to reach out and want to get into treatment there? What could they expect? What was the process like?
Yeah, absolutely. So anytime you contact Linden Oaks, the first thing that you receive is a free assessment for the level of care that's best for you. If we don't think that we can meet you just at that clinic, at that level of care, we'll recommend something else. But for that clinic in particular, what it looks like is it's once a week's treatment where you come in for about a 2-hour block. You meet with your medical provider, and then you get a psychosocial group. So you get that treatment along with the medication. If things go well for about a month, negative drug screens, everything looks good, all your needs are being met, then we generally drop folks down to every other week. And then after that, down to once a month. So really what this looks like is just someone coming in once a month for about 2 hours, also meeting with a case manager as needed to make sure that they're on the right track, hopefully slowly coming down off the medication so that eventually they're not on anything at all.
Okay. Now that sounds like a good process, but obviously the first step is always getting there. So talk a little bit, if you would, about how should I know if I should show up? Well, really, knowing that you have a problem is the most important part. And what that looks like is that if you feel like your pain medication use might be getting out of control, if other people have expressed concern to you, if you're prescribed a certain amount, but you find that you're either like taking a little bit more sometimes or taking less some days, so you have more for others, it's been edging up over time, it doesn't really feel like you're in control of it anymore, that you've really noticed it grow and you're concerned, that's a good time to talk to your doctor or to give Linden Oaks a call. Okay. If you would like to learn more about the MAT Clinic at Linden Oaks, please go and visit their website. We're going to take a quick break for a few short messages, but don't go away. We're coming right back with more Spotlight.